Hello, and welcome to this overview of the Centers for Medicare and Medicaid Services, or CMS. My name is Franziska Merkel, and I am a reimbursement and regulatory specialist for diagnostics within the Small Business Education and Entrepreneurial Development, or SEED office. All right, let's get started. If you've listened to our segment on purchasers and payers of medical technology, you've already learned a bit about third-party payers. So we will do a quick review and then dive deeper into where CMS fits in and define the role of CMS, specifically as a third-party payer. We will also cover the impact of CMS on medical device reimbursement and the best way to stay up to date on CMS policies, regulations, and payment rates. So what are third-party payers and how does CMS fit in? If you've listened to one of our other recordings in this series, you've learned that third-party payers purchase services from health systems. They do not pay manufacturers directly. Also, third-party payers pay for a healthcare item or service based on a claim, and that claim is submitted by a healthcare provider. Third-party payers can be grouped into public and private or commercial payers, and the Centers for Medicare and Medicaid Services are one of the public payers. CMS includes Medicare, Medicaid, and the Children's Health Insurance Program, or CHIP. Now, the Centers for Medicare and Medicaid Services, or CMS, are the focus of our conversation today, as they are a public payer, policymaker, and regulator all in one. Now, we've talked a lot about CMS, but have not yet dove into the CMS role as a third-party payer. So what does CMS stand for? CMS is the acronym for the Centers for Medicare and Medicaid Services, and CMS is a federal agency within the U.S. Department of Health and Human Services, or HHS. And its responsibility includes administration of the Medicare, Medicaid, Children's Health Insurance Program, as well as the Health Insurance Marketplace Program, which provide healthcare coverage to millions of Americans. CMS's role also entails improving healthcare quality, the reducing of healthcare costs, and enhancement of the overall U.S. healthcare system. In short, CMS provides healthcare coverage to more than 160 million individuals through Medicare, Medicaid, and CHIP, as well as the Health Insurance Marketplace. And CMS works in partnership with the entire healthcare community to improve quality, equity, and outcomes in the healthcare system. The coverage CMS provides can be broken out by patient population. In general, for Medicare, we are talking about coverage for people of 65 years and older. In terms of Medicaid, it is coverage for low-income families and the disabled. The Children's Health Insurance Program provides coverage for children, as the name implies. And then lastly, on the commercial side, the Health Insurance Marketplace provides coverage that is for eligible individuals through the marketplace. So let's review the third-party payer categories. We covered the different players that fall either into the private or commercial and the public payer categories. Today, I wanted to take a deeper dive into which patient populations are covered by each payer and how those eligibility criteria are defined for each. Now let's shift over to public payers, specifically the Centers for Medicare and Medicaid Services, and I wanted to focus on Medicaid and the Children's Health Insurance Program, or CHIP, first. The individuals who are eligible for Medicaid and CHIP include low-income families, pregnant women and children, low-income elderly, and also the blind or disabled. Now, the key decision makers here, that is something interesting because CMS has some oversight of all state Medicaid programs. However, states each run their own program. And then there are the Medicaid insurers who contract with most states to manage Medicaid population health. We already talked about a little bit about Medicare and that individuals age of 65 and older are eligible under that payer. But it also includes adults that are disabled for more than 2 years and those individuals who suffer from end-stage renal disease. The key decision makers here are CMS and specifically the Coverage and Analysis Group, or CAG, and then Medicare Administrative Contractor Medical Directors, as well as health insurance servicing or serving Medicare Advantage market. There's also a group called dually eligible beneficiaries, and per CMS, dually eligible beneficiaries are generally described as low-income beneficiaries that are also enrolled or that are enrolled in both Medicare and Medicaid. A little bit more on that later. Now, non-groups are dedicated to individuals or small businesses, and in terms of individuals, that would also include near retirees. The marketplace plan can also be obtained through or for CMS. So once you get into the eligibility criteria for Medicare, so age 65 and older, that is also something that is available to individuals as an add-on to other Medicare services. So how does CMS impact reimbursement strategies? CMS sets coverage policies, reimbursement rates, and quality measures for healthcare services provided under the programs we just talked about. So understanding these policies and payment structures is crucial for innovators such as yourself to ensure that your products or services align with CMS requirements and have a potential market among beneficiaries. Now, CMS is continuously working to improve healthcare quality, access, and affordability through various initiatives and programs. And as an innovator, you should be aware of these initiatives, as they may provide opportunities for you to collaborate or may support your innovation. For instance, the Center for Medicare and Medicaid Innovation, or CMMI, also known as the Innovation Center, is a division within CMS that tests innovative payment and service delivery models. All that to reduce healthcare costs while maintaining or improving the quality of care. So it is a good idea to monitor CMMI's initiatives and consider participating in relevant programs or demonstration projects. And it is also good to know that CMS is increasingly focusing on value-based care and alternative payment models that reward healthcare providers for delivering high-quality, cost-effective care. So understanding these models and considering how your products or services can support value-based care initiatives is essential. Now, developing innovations that address these specific needs and improve access to high-quality care for these populations can increase your likelihood of adoption and success within the CMS system. So while we talked about how CMS in general impacts medical device reimbursement strategies, I wanted to give a specific example, the example of price determination. Prices are actually determined based on rates. While it is very important to understand the unit cost for your innovation, payer prices are generally set based on the rate the Centers for Medicare and Medicaid Services, or CMS, specifically Medicare, sets for the specific product or service. And based on that rate, other payers set their own rates. So, if we use that knowledge that the Medicare rate is used by other payers, may it be public or private, we can say that the rate is sort of our base at 100%. One of the reasons is that for established products, CMS has a so-called fee schedule where you can look up the rate for each product or service based on a code. More on that later. Now, looking at other public payers, Medicaid and the Veterans Administration, or VA, also use the Medicare base rate. Medicaid generally set their rate at 70% of the Medicare rate, and then the VA sets it at 40% of the base Medicare rate. Quite a range, right? Now, we are shifting to private or commercial payers. They, on the other spectrum, set their rate generally at 120% of the Medicare base rate. Lastly, I wanted to make a plug for another module on navigating CMS fee schedules. So what are CMS fee schedules and why are they important? Per CMS, a fee schedule is a complete listing of fees used by Medicare to pay doctors or other providers and suppliers. It is a comprehensive listing of fee maximums, so that is an important point. These are fee maximums that are listed there, and they are used to reimburse a physician or other providers on a fee-for-service basis. Please tune in to the module on navigating those fee schedules to learn more on that topic. The CMS.gov website is a great resource to stay up to date on topics such as the regulations and guidance for Medicare, Medicaid, and CHIP, as well as the marketplace. For instance, the Medicare coverage database allows you to search policies by keyword, code, or document ID. And you can always learn more about the subject on navigating the Medicare coverage database in one of our other learning modules. Here are a couple of high-level points I hope you took away from the session today on CMS as a public payer. And in addition to being a public payer, CMS is also a regulator and policymaker. And as such, it is important for innovators of medical technology to understand the following: that CMS is a federal agency within HHS, and as a public payer, CMS provides health coverage for more than 160 million lives through Medicare, Medicaid, CHIP, and the health insurance marketplace. So it is also important to understand patient populations that are covered through CMS. So you should consider the unique needs and challenges that are faced by the Medicare and Medicaid beneficiaries, the lives that are covered by CMS, and that could include the older adults, low-income individuals, and people with disabilities. And you can always learn more about how prices for medical technology are determined and negotiated, as well as how to navigate CMS fee schedules in one of our follow-on modules. And if you still have questions after listening to this recording, you can always reach out to us and request a consult with someone from our team.